Hi everyone, welcome to the presentation on racism as a public health crisis. My name is Marisol Torres. I am one of the health educators of the WELL, and I'm also the advisor for Golden Arches, which is a peer health education group that is one of the peer health education groups at the WELL. I have a master's in public health and my work is in public health, and specifically one of the things in public health that I am passionate about and have training on is on racism. So for today, the conversation is about racism as a public health crisis. As you all might have heard, a lot of counties or cities are declaring racism as a public health crisis. And this presentation is meant to give you a better idea of what exactly does that mean and how does racism play a role in public health. Keep in mind that racism in public health, although it is a hot topic right now, given all of these the killings that have made it to media, as well as the protests and uprisings. But keep in mind that racism has always affected public health, and that for decades, folks in public health have been working to try to make this an important aspect of what public health is. And although it's not only up for public health to make changes to racism, public health is an important field that needs to actually focus on racism. So before we get more into discussion about it, I want to make sure we have two definitions clear. So one is public health and one is racism. So first we'll start with public health. The best way for me to explain this is actually through a story. So imagine that you are hiking in this wonderful place and you're hiking right on the side of this river and everything's going fine. And then all of a sudden you see someone who has fallen in the water and they're drowning, and somebody rushes in, takes them out and saves them. And you're happy that they're fine. And you continue with your hike and you see someone else who now has also fallen in the water and is drowning, and someone comes in and saves them. And then as you continue to your hike, you see a third person who has now fallen and is drowning, and someone comes in and saves them. Now you are concerned. This seems really out of character. It's not just one person, now it's three people, and it seems to continue to happen. So you decide, you know what, I need to figure out why is this happening. So you continue your hike and you get to that bridge that you see there. This bridge, you notice, is broken, and one of the wooden panels is loose. And it's big enough that somebody can fall through it. And you realize this is why people are drowning. So you found the cause for it. So you decide, I'm going to put up a sign that says, be careful when you're crossing, you may fall. Or maybe you decide to fix it yourself, or you call a representative from your city to fix that. Or perhaps you make a sign that creates a different way that people can go without having to go through that bridge. That is really more of what public health is, looking at the root causes. What is causing people to be injured? What is causing people to be unhealthy? And what can we do to fix that? The folks who are out there saving, in this metaphor, the folks who were in there saving people who were drowning, that's oftentimes what people think of when they think of health, like healthcare professionals, so doctors, nurses, paramedics. So those folks are out there saving people who might be injured or who are already in a bad situation, while public health is about prevention. So public health promotes and protects the health of people in the communities where they live, learn, work, and play. So it really could literally be in a hike, right? In an area, an outdoor area, but it can be anywhere. It could be at your work, it could be in your community, at your school, all places around you, right? It's public health. So it's all of these places that are around folks. And it's also about prevention. Right? So again, while a doctor treats people who are sick or who are coming in with some kind of symptoms, public health professionals try to prevent people from getting sick or injured in the first place. We're also about population health. So we're not looking at just saving one person, right, from that river, but how can we save other people, groups of people, from falling into the river? So public health is about how can we work in saving populations. The next definition is racism, and racism is very complex, and there's many definitions out there, and I'm just going to give an example of one definition that is used in public health at times. So racism, as you can see here, is a system of structuring opportunity and assigning value based on the social interpretation of how one looks, which is what people call race, that unfairly disadvantages some individuals and communities, unfairly advantages other individuals and communities, and shapes the strengthening of a whole society through waste of human resources. Key words here is it's a system of structuring. So it's not necessarily only one-time acts, but it's a system that is within our society, and that it places value on what we sometimes call race, right? And also it advantages some people and it disadvantages some people. So racism has advantages for some and disadvantages for others. And also that this is actually a waste of human resources. So racism is a waste to our society and doesn't help build a healthy, functional society. So how does racism and health come in hand? So historically rooted institutionalized racism placed some individuals and groups in vulnerable positions, as we talked about with racism, and this makes them to have exposure to chronic and daily experiences of discrimination, leading to inequitable health effects. So things to remember is here we're talking about chronic and daily. So it's not just a one-time thing, but it's chronic. That means it's in a person's lifetime, every day, throughout their life. They're experiencing some form of racism. Remember, it's institutionalized as well. So obviously, yes, it affects a person if somebody says a racist thing or immediately does something racist in front of them, and that can have, you know, effects on that person, but also thinking about it as an institution where there's larger everyday racism that we might not see and we might not feel automatically, but it's having a huge effect on folks. And these not only has an effect on folks personally, right, when you experience racism every day, it takes a toll on your body and on your mind, but it also leads to inequitable health effects in a larger system scale remember about putting some people at advantage and some people at a disadvantage has an effect on folks' health. Another term we use often in public health is social determinants of health. These are very well researched and well proven determinants that we consider, factors that we consider determine how a person's health will be, or how a population, right, or group of people's health will be. So one is economic stability. So is there poverty? Is there money? Is there an ability to move up in the economy? Social and community context of what is happening around them in their society and their community. And neighborhood and environment. So what is their environment like? What's their neighborhood like? Healthcare, do they have access to quality healthcare? And education, whether they're provided adequate education. We know that all of these are social determinants of health. They all affect the community's health. So if the economy, healthcare, education, the environment, whatever effects they have, they will affect a community in either a good way or in a bad way. Racism plays a role in all of these. So there's racism in education, there's racism in healthcare, in the environment, in pollution, in social and community context, in the economy. So racism plays a role in all of these social determinants of health. So we will skip the group discussion for now, but I wanted to give examples of some of the those social determinants of health. So the first one is healthcare access and quality. So we said healthcare is a social determinant of health, and racism is embedded within healthcare. In this particular example, we're going to talk about having access to healthcare. So are you able to receive healthcare? And then quality of healthcare. How good is that healthcare? And how does racism affect that? So due to long-term structural racism, Black Americans and other people of color face unique barriers to assessing reasonable and appropriate healthcare. And here are some very specific examples, and please keep in mind these are only some, and as I'm talking about this and doing this presentation in 20 minutes or so, keep in mind that we can talk about this all day and we still will not be able to really capture every way that racism affects public health. So here are some examples of racism in healthcare and their effects on folks. So access to healthcare, we know, is associated with reduced racial disparities. So when we compare people who fall in certain race groups, and we see that certain race groups have more of something and certain race groups have less of something, in this case, health, right, or health and well-being, we know that having access to healthcare helps balance that more. And it also does that for cancer diagnosis and treatment. So the access to healthcare makes it so that those barriers and those disproportionate things regarding cancer diagnosis and treatment become more equalized. So healthcare access is important. Now, how does racism affect healthcare access? Well, 2 times greater likelihood for Black workers to be uninsured than white workers. So if someone doesn't have health insurance, that's a huge barrier, right, to having healthcare and to getting healthcare. So that's huge access, a huge barrier to accessing healthcare. And note in this fact that I shared with you, right, it's 2 times greater for Black workers to be uninsured than white workers. So we're still talking people who are working. So these are people who are contributing to society, who have a job, and yet, even though they're both equally have jobs, 2 times greater likelihood for Black workers to actually not have insurance. And we know that in this country, our work is often what links us to healthcare. My healthcare that I have is because I work at UCR, and UCR provides me that healthcare. And that's the case for majority of Americans. So even though they're both working, right, with groups of people are working, they're still not the same amount of insured. Women who live in areas with greater Black segregation, right? So areas where it's mostly Black folks who live there, from 1992 to 2002 were 27% less likely to receive adequate breast cancer care. So if you think about just breast cancer care on its own, just for living in a certain area, you're less likely to receive adequate breast cancer care. And living in a certain area in this case means living in an area that's predominantly Black. ZIP codes with high populations of white inhabitants have almost double the amount of COVID-19 testing sites that predominantly non-white ZIP codes. So double. So currently, as we speak, right, not in the 90s, not in the 70s, or in the early 1900s, but currently as we speak, those areas, those ZIP codes that have a larger population of white inhabitants have almost twice the amount of COVID-19 testing sites compared to those non-white ZIP codes. And compared to white patients, Black patients are 42% less likely to be treated by a cardiologist for heart failure upon ICU attendance. So again, it's not even about whether they have more heart failure, right? Whether people of color have more heart failure than white folks, right? Even though, that could be something we discuss, but it's what about giving them care, right? So even though they might have, both have these heart failures, Black patients are 42% less likely to actually be treated by a cardiologist when they go into ICU versus a white patient. Keep in mind, these are just some examples. Other examples that were given by students were examples about in medicine and in the books as people are studying to be doctors and physicians and nurses. Oftentimes the examples they give there are of people, are white people or people of fair skin. So even when you're thinking about something like skin cancer, they teach them how to diagnose skin cancer in light skin patients, right? And so they're not well trained on how to even be able to identify skin cancer on someone who have darker skin. So those are some examples. The other example also given by students was the mistrust of healthcare professionals by people of color, and really the validation of that mistrust, because for centuries in medicine, oftentimes they mistreated people of color and did horrific things to Black folks and other people of color. And because of this, for decades, in centuries, really, there is a rooted mistrust, right? And good reasons for it. So it's really hard to trust doctors, and it's really hard to trust nurses when there's been so many horrific things that has happened in their hands. Another example of social determinant of health is school and education. So because of racism, there is an imbalance between resources dedicated to well-being of students and the punishment of these students. So before I go to my example, some of the examples that were provided by students was the example of not having certain books, right, or not having certain quality books or enough books because schools of certain neighborhoods and certain areas are provided with more money and more funding for it. And so an example that was given by someone, by a student, was that at a school, books were stolen. And again, so now we're talking about schools in unsafe areas, and there's a lot of reasons why areas are unsafe, and it's not necessarily about individual behavior, but a lot of the structures that have made it in there, whether it's poverty, violence. And so books were stolen, and instead of the school purchasing new books right away and trying to figure out a solution to educate students, they put on movies and had students watch movies instead. So again, the lack of resources. They don't have the money to buy those books, maybe now or maybe who knows when. And so now they are not getting that education. Another example was currently right now during COVID and distance learning, and how that also plays unfair for some students, especially students of color who might not have access to computer, reliable internet, or even being able to have childcare at home or someone to be there to watch them and to make sure that they are logging in and doing all of these things, or even a home where they have their own private area or their private room to help them with it. So some of the examples I have here are that white school districts average $23 billion more in annual funding than non-white districts. So again, going back to the example that was given about the school books, right? If they're gone or stolen, or we can't even purchase them, right? $23 billion more annual funding in white schools and non-white districts. That's $1,500 more per student by poor white versus non-white districts. So even, again, sometimes people think, well, it's not necessarily racism, it's really about poverty. And of course, poverty and income is important. We know that's a social determinant of health, but we also know that racism plays a role in that, plays a role in poverty, plays a role in the economic and thriving of communities. So in this case, it's a perfect example. Even poor white students or poor white school districts, right, where most of their students there are poor and white, they still receive $1,500 more per student a year than non-white districts, whether they're poor or not. So whether these non-white districts have money or not, they still receive less than those districts who are poor and white. Guidance counselors. So we also know by research that guidance counselors help improve school climate and school safety and graduation rates. So it's very important to have school guidance counselors that really help provide a better climate on campus, provide better safety and ways to deal with conflict, and obviously improve graduation rates and improve education. So that's something we know, but it's twice as likely for public school with a higher proportion of white students to have the recommended number of guidance counselors. So we see a lot of more of these school districts that are predominantly Black or students of color that have way less guidance counselors and way more police and policing. So that was also an example that someone provided, a student provided in the past regarding school to prison pipeline. So when you fill schools with police officers, they're more likely to catch students doing things and more likely to then put them in imprisonment in some way, right? And more likely for them to drop out and all these different things. So again, the imbalance of having guidance counselors versus police, which goes on to The next point, so compared to white counterparts, Black students are overrepresented across types of disciplinary action. So again, when a student gets in trouble at school for whatever reason, maybe it was saying a bad word, maybe it was having drugs, maybe it was getting in a fight, maybe it was dress code, they have way more disciplinary action than white students. So not only, so they're getting punished at a much higher rate, and even though they're getting punished at a much higher rate, they're not doing these crimes, or some of them aren't even crimes, right? There's just like school policies. They're not violating these policies at higher rates than white students. In fact, we have seen research where where young white males, right, so very young white males, so thinking high school, even college, are actually involved in more of drug use and drug sales. But yet, those who are being caught or are being placed in disciplinary action are mostly students who are Black or students of color. Another example I'm going to give is the environment and pollution. So air pollution is worse in Black communities, which are disproportionately near highways, waste sites, factories, and industrial plants. So somebody gave an example, a student gave an example during one of these presentations that one of the reasons for this is redlining. So redlining is a real thing that happens and has happened for, again, many years, where the government structures ways so that certain people live in certain areas and other people live in other areas. And so by that, I mean, most of the time it's split up by people of color in one neighborhood and white people on another neighborhood. Even poor white people, right? Even poor white people tend to have separate neighborhoods than poor people of color, or even non-poor people of color. So really just proportioning it so that people of color, Black folks and people of color, live in communities near highways, waste sites, factories, and industrial plants, which affects a person's health. We're talking about respiratory, skin, everything you can think of, right? You live, work, and play in these areas your entire life. It's going to have an effect on you, especially as children. We see that as a big issue. 71% of Black Americans versus 58% of white, I should say white, Americans live in counties that violate federal air pollution standards. So luckily, you know, this government does have standards of air pollution, but that doesn't mean that it's equal all around. Oftentimes, if you think about counties or cities, they might kind of average it out, where they might say, well, your county meets the regulations because sure, you have really high air pollution here, but your air pollution here is really great, so together on average you're doing great. But in reality, again, air pollution is affecting other communities more. And again, so 71% of Black Americans live in counties that violate federal air pollution standards, that are not abiding by these standards that the government has set. And that is way more than 58% white. 2 times the rate of and 10 times mortality from asthma in Black versus white children. So we see asthma, especially here in the Inland Empire, Riverside, San Bernardino County. Asthma is one of the big health impacts we're seeing, and it has a lot to do with our air pollution. And again, where these folks are living and which areas they're living varies greatly based on their race. Race, not poverty, is the strongest predictor of exposure to fine particulate matter. So again, oftentimes race and poverty get thrown around as, well, no, it's not really race, it's actually poverty that's causing this. And we talked about how poverty is important, but race affects poverty. In fact, racism often is what causes poverty. So when we're talking again about public health, right, getting to the causes of the causes and the deep root causes. So race, not poverty, is the strongest predictor of exposure to fine particulate matter. So when we're looking at exposure that people have to this fine particulate matter that is unhealthy for us, for our lungs and for our eyes and all these different things, what they find that it's not necessarily based on how poor a community is, but the race of a community. 54% higher exposure to polluting air by being Black than by being in poverty. And lastly, people who live in heavily polluted areas are also more likely to die from several different things, right? So one example currently is COVID-19. So there is an increase, 8% increase in COVID-19 mortality with just a tiny small increase in air pollution. So only having a little increase in air pollution actually increases COVID-19 mortality by 8%. So you can imagine when you're living in areas that had large amounts of air pollution, your a community's probability of dying from COVID-19 is a lot higher. There's also lots of other examples of how race and racism affect public health. So really, these are just some general examples, and it could be in anything from sexual health to, again, more about the areas that we live in, occupational health, different things. Other examples students have given is also talking about just microaggressions. So in a larger scale, right, person to person, that can also have an effect on people. And also, you know, in work areas or school areas. So all these different kind of things. So actually some other examples I wanted to give was like sexual violence. So 90% of child sex trafficking victims in LA were Black, and 57% of juvenile prostitution arrests are of Black children. So as, again, another hot topic right now is child and sex trafficking, and it really has made itself a hot topic often because of, you know, this idea of Hollywood or whatever, which is actually, we don't even know if that's the case, but what we do know for sure is that child and sex trafficking has been a thing for many, many, many years, and that it has predominantly affected Black children. Environmental racism is also an example. So pollution, redlining, we talked about that. Climate change, so extreme weather is more likely to happen in areas that experience extreme heat and natural disasters. So again, depending on where you live, climate change is going to affect you differently and what you have, right? If you have the access to purchase things to make climate change less of an effect on you, right? So that's also a factor. And natural disasters, like in Katrina, for example, Black residents were 2 times more likely to die than white residents, even though it was the same disaster in the same area, right? Black residents were still 2 times more likely to die. So where they were living was much more unsafe for these types of natural disasters. And that is part of the way the infrastructure is. On a positive note, when we declare racism as a public health crisis, the goal is that it's not just declared, but that actions are taken. We want to create not just equality, right? So we talk sometimes about health equality. How can we make sure everybody has access to everything at the same level, which only makes it still uneven, right? If the person who has all these things already of access gets more, then they'll have even more. The person who doesn't have it gets the same amount as the other, the levels are still disproportionate. Equity is about providing more and giving more and having resources and support for those who need it the most, so that everyone can be in an equal playing field, right? To that extent. So often we talk about health equity, but I say dream for liberation as well. So if you see in this picture where you have 3 individuals behind a fence trying to see this baseball game, and in equity, they were given the same box and they still can't look all of them over the fence. In equality, you give some of them more boxes so they can look over the fence. But in liberation, let's get rid of the fence. Why do we have the fence? Why do we have these barriers? Let's make this accessible to everyone. And lastly, how is the WELL committed to anti-racism? So the WELL it's a health promotion and education department. Again, we're rooted and work with public health. and that's what our backgrounds are in. So some of the things we're doing is that the WELL helped launch an anti-racism healthy campus subcommittee. So out of the WELL's initiative, that was able to bring it to Healthy Campus, and now there is an actual anti-racism committee on campus specifically for health and well-being. The WELL also integrates race and racism into our presentations and our programs. So for example, Golden Arches does presentations on sexual health, and they integrate reproductive justice on there, right? So how does race play a role in our sexual health? And then list of resources from and for people of color. So if you also go to the WELL's website at well.ucr.edu, we have resources for mental health, we have resources for sexual health, drug and alcohol use, lots of different types of resources, and we make sure that we have on there links and resources that for apps and things that are from people of color and for people of color, and training in racism and public health like this, right? So not only are we, not only are many of us have training in this, you know, it's part of our work, but we also provide trainings like this for folks. And the WELL also has a book club on anti-racism, and soon, once campus opens, we hope to be able to provide these for you all. So we will have a wellness library that has lots of different work, but part of it will be also about racism. We also, as a staff, professional staff, and also for our peer groups, we have implicit bias aptitude tests. So we require all of our staff to take this test. It's a free test that can be taken online, and it helps a person see where their biases stand. You know, if they have certain bias based on race and other factors, so that as staff, we're well aware of where biases are, and we can work towards trying to prevent these biases from having us do good work. And then also our peer educators receive training on racism and public health. So again, these are all sort of the work that the WELL has been doing and is committed to anti-racism. And now think about how do you or can you bring anti-racism work to your peer group, your department, wherever you're at? So think about that. Maybe you already do it, and maybe it wasn't called that, you didn't think about it, or maybe you have always been doing it and it's always been very explicit about anti-racism. Maybe you're not sure and you want to make sure that there is work done. So think about ways that you can continue to do anti-racism work here on campus. And thank you all this is the end of the presentation. If you do want to contact me at Marisol, so MARISOL.Torres, TORRES, at ucr.edu. Feel free to email me or email the WELL, and we will be happy to provide any more information or any way that we can support you. Thank you and have a great day.